Hi, I want to give you an update or a little more information, if you will, about the flu that's going around this winter. And this is the winter of 2017. Number one fact to know is that the flu vaccine is only about 10% effective this year. That's worse than last year. Last year it was 21% effective. This year it's only 10% effective. Second thing to know is that what homeopaths are seeing are not true flus. They sort of present as a flu. People have a runny nose, they have some fever, they've got some aches, but it's not a true flu because what's happening is their airway, their respiratory tract is becoming reactive to what's going on. And I've seen one of the world-renowned homeopaths in the New England area write that he felt that it was a meta-virus. It was a meta-pneumovirus that was causing this reaction to people. And it was not just in kids, it was in adults who had had asthma as a child, but they weren't asthmatic any longer, and now they're finding that this is happening this winter. So I have to read it because there's a lot of information. In adults with a sore throat, they've got a laryngitis, there's even pain in their throat, and it's worse when they cough. Or you've got adults with a sinus infection that leads to an earache and a sensation of that ear being all stuffed up. Or you've got babies and young children with common symptoms. They've got an increased fever, they've got a flushed face, they're a little listless, and they're irritable. And you've got adults who are over 60 years of old and they're developing symptoms of asthma, which are characterized by an incessant cough ending with a wheeze, which is unusual. Let's face it, you cough and you don't necessarily wheeze at the end. They can find it difficult to exhale properly. So these are the way all of this virus is presenting in a variety of different populations, different people. Initially, the remedy that they were using was gelsemium. Now they've gone to lycopodium because it seems to be working better. The breathing is better in cool air. Their sore throat is better from warm drinks if they need lycopodium. Causticum is the second remedy that you might consider, but you can also consider gelsemium. So take a look at what's going on and see whether gelsemium isn't a better fit. Or if you've tried lycopodium and it's helped a little bit, but not a lot, consider going to causticum, just one dose. What you're looking for is at least a 40% improvement in all over symptoms. You're not looking for, oh, I feel better. What's better? You're looking for 40% improvement. You felt like awful, felt like crap, if you want to be really specific, in the beginning, and now you feel better. Well, how much better? This is something that's really kind of hard to get people to tell you, but it's really important when you're trying to choose the right remedy, because the wrong remedy is just going to lead you down this path that's not going to get you anywhere. And then you're going to have to backtrack and use another remedy. So it's nice to be able to get the right remedy in the beginning. Hopefully those tips will help in choosing the right remedy for the crazy non-flu that's going around now. And the 10% effectiveness of the flu vaccine is a nice thing to tell family members who are going, I need to get my flu shot. Why? 10%? I mean, you might go for a 10% sale, but a 10% effectiveness, do you realize how many flu strains are out there? It's not worth it, especially when one of the side effects of vaccines is something called Guillain-Barré. Guillain-Barré syndrome starts at someone's feet and works its way up, paralyzing and making muscles useless for the person until they end up in ICU on a ventilator and months of rehab once they get off that ventilator. Why? For one vaccine. Wash your hands really good. Don't touch your mouth or your face after you've touched anything else. Wash your hands before you touch your mouth or your face. Enough vitamin C, enough vitamin D, and make sure you keep up on probiotics, and you're not going to come down with the flu this winter. And you're not going to need flu vaccine. Have a oscillococcinum at home if you have the flu, instead of this sore throat and warm drinks and, all of these symptoms that I talked about. But if you've just got the regular old run-of-the-mill flu, oscillococcinum is the remedy that you need. It comes in those long white boxes with all the orange little box, gradations of orange boxes across the front. It's the name of the remedy that you cannot say. It took me 2 years to learn to say it. 1 globule, which is the size of a poppy seed. So get out your tweezers because you're going to need them. But 1 globule, and repeat in 4, 6, or 8 hours, depending on how severe the symptoms are. If somebody feels really, really bad and the symptoms are really severe, 2 hours in between doses. But you want 40% improvement. You want 60% improvement. And if you've gotten 60% improvement by the time a second dose is given, see how somebody feels in a few more hours to know whether you're going to give a third dose. You don't necessarily have to. No more doses, just 3, and you will have a really good response from oscillococcinum. It might not be oscillo. That's one of the remedies given for flu. But if it's just a run-of-the-mill flu, it's nothing. You're not doing anything different. You're not craving a different kind of food. You're not doing anything in your life that is different. A flu. You feel achy, you feel feverish, you feel like crap. You just, not the sneezing and the whatever, because that's a cold. And the way you tell a cold from the flu is colds develop slowly. You get up in the morning, you're fine, you go to work. By 2 o'clock in the afternoon, you're going, By 5 o'clock in the afternoon, you're going, I think I'm coming down with something. If you've got the flu by 11 o'clock in the morning, you're going, I'm starting to feel really rotten. That's the flu. It comes on quickly, so then you give yourself, and carry the oscillococcinum with you. And if you can't pour out just 1 globule, try to make it as few as possible, because you're not carrying your eyebrow tweezers with you to work. But don't take the entire vial. You don't need to. That's the company that wants you to take the entire vial. They want to sell more remedy. When you buy 1 box of oscillococcinum, you can use it until the day you die, because there's so many poppy-sized seed pellets in that vial. You could treat the entire town. Why not? Anyway, this is the flu tips for this particular winter. Hope it helps. If it doesn't, leave me a comment on this Facebook page, or leave me a comment on my YouTube channel, and I will get them and respond to them. Help you. Bye.